Well, good evening. Thank you for joining us. I'm going to go ahead and get started, even though it looks like people are still trying to find their way in. And thank you for joining us for this conversation with an interdisciplinary panel of experts about how children and families are doing in the current context of the pandemic and what is needed to support children's health, social, emotional, and academic well-being. My name is Liliana Lengua. I'm the professor of psychology in the Department of Psychology at the University of Washington and the director of the Center for Child and Family Wellbeing. Our center promotes children and families' well-being by engaging in research that contributes to our understanding of children's resilient and vulnerable responses to stress, and to sharing current research with our community in events like tonight's. We take a whole child approach in our perspective of child well-being, recognizing that children's health, mental health, their academic success, and their family relationships are all interdependent, and they are impacted by the systems and policies that surround them. So with that in mind, we brought together colleagues from the University of Washington who are experts in children's health, their school contexts, public policy, and mental health. So before I introduce our panel, let me point out some logistics for the evening. There will be some time at the end for us to address questions. So as the evening's going and you have questions, please type them in the Q&A so we can get to them towards the end. If you have technology issues or questions that are more logistic, put those in the chat and our team will be monitoring the chat. We've asked our panel to tell us a little bit about the work they do in general, and then how they've been focusing their time and energy during COVID, what they've been focused on during the pandemic, to talk a little bit about their perspectives of how children and families are doing right now, and then what is needed going forward to support children's and families' well-being. So with that, let me introduce our esteemed panel, and then we'll get started. Joining us is Dr. Heather Hill, who's a professor of the Evans School of Public Policy and Governance. Her research examines how public and workplace policies influence family economic circumstances and child well-being in low-income families. We have Dr. Anisa Ibrahim, who's the clinical assistant professor of pediatrics and Harborview's pediatric clinical medical director. Dr. Ibrahim's clinical interests include caring for and outreach to immigrant and refugee populations, specifically those with medical complexity. And we have Anne Ishimaru, who's an associate professor who works in educational foundations, leadership, and policy in the College of Education. Dr. Ishimaru's scholarship focuses on the intersection of leadership, school-community relationships, and educational equity in the preschool through 12 educational system. So thank you all for making time to be part of this discussion this evening. I really appreciate you being here. Let's start with having each of you share a little bit more about the work that you do in general and what you've been focusing on specifically during the pandemic. And let's start with you, Heather.
Thank you, Lily, for that nice introduction. Thank you, everyone, for joining us tonight to discuss this important topic. As Lily said, I'm a faculty member in the Daniel J. Evans School of Public Policy and Governance, which is at the Seattle campus of the University of Washington. And I study public policy and programs that are designed to reduce poverty and inequality. I'm a local. I was born and raised in Tacoma, and I left the Pacific Northwest for many years, but was lucky enough to get to come back. I'm also a parent of a 9-year-old, so I've been riding the roller coaster of pandemic parenting along with many of you and the families that you serve. But today I'm speaking to you as a researcher who studies family economic circumstances and how they affect parenting and child health and development. I wanted to tell you about my motivation and my position studying this topic. I focus on this topic because poverty and inequality give the lie to the American dream, in my opinion. Poverty and inequality during childhood constrain opportunities and negatively affect health and wellness, and these effects can be lifelong. So not only is the high level of child poverty and inequality in this very rich country arguably immoral, as I believe, It also costs us greatly as a society in terms of productivity, lost productivity, healthcare costs, and more. So as a researcher, I try to influence policy and practice that will reduce poverty and inequality and reduce its effects through careful and independent scientific inquiry. But in doing this, I recognize that this is just one type of knowledge, scientific knowledge. And I think it's important to name that I do not have the knowledge of someone living in poverty, and that my experiences of inequality are often on the positive side, the privileges that I'm afforded as a white woman with a lot of education and sufficient resources. So I try to bring humility and awareness to other ways of knowing, non-scientific ways of knowing in the work I do. I study specifically how income support programs like the Earned Income Tax Credit can not only boost income for families, but also reduce child abuse and neglect and improve health and well-being for both kids and parents. I also have studied how income fluctuations affect children and parents. Low-income families are particularly likely to face fluctuating income due to work hour changes, employment changes, public program participation changes. And that was true even before COVID, which has obviously been a massive disruption to income. And there's some evidence that we have that separate of the effects of having insufficient income, that having income fluctuate a lot is stressful for parents and affects adolescent outcomes at school. I've also studied wealth inequality among families with children, which, believe it or not, is even worse in this country than income inequality. The gap between the richest and poorest families with children is larger in the US than in most other similar countries. It's larger for family with children than for families without children. And the racial gaps in wealth are much larger in the US than the racial gaps in income or education. Now, my only research project currently that focuses directly on COVID is focused on older workers transitioning to retirement and out of the labor market during COVID. But I've been closely following both the economic indicators of how families are faring during COVID and also the major social policy innovations and expansions that have occurred through the stimulus and recovery bills during COVID. So that's what I'll focus on when I talk today.
Thanks, Heather. Anisa?
Hello, everyone. I'm Dr. Anisa Ibrahim. I am a pediatrician, and I work in the Harborview Pediatrics Clinic, where I serve as a medical director. My other passion, my specific expertise is in refugee and immigrant health, as Liliana had said, but my specific passion is really community, and I take that in every sense of the word. I really enjoy community engagement, outreach, mutual respect in our learning collaborations, and then I also enjoy I also focus on centering communities in the things that we have done, while acknowledging that the healthcare systems that I work for and sometimes represent have harmed communities, specifically communities of color, specifically Black communities. So, the other hat that I do wear is I'm on the board of directors for the Somali Health Board. That is a local ethnic health board and a grassroots organization that whose goal was to help address the inequities that led to disparities in our community. And this became came more to the forefront, not just for the Somali community, but the community that the Somalis lived in Seattle when COVID hit. I think, as a pediatrician, I see patients day in and day out, and it's a true honor to be able to care for families and their children. It's something that I, as a parent, I have, 3 of my own kids, 2 who are school age and 1 who's a toddler, and it's such an honor to have a family trust you as their partner in health and the well-being of their most precious thing, which is their children. I think in the past couple of years, there's been, my work interfaces with COVID every single day. And that's whether it's in the 4 walls of the hospital, or actually the real work is in the community. And since this pandemic hit, we spent a lot of our time, and I personally spent a lot of my time being in the community, listening, holding listening sessions, holding community conversations, looking at what are the concerns, what is actually happening, not what healthcare and systems perceive as happening, and having one-on-one conversations and really, not doing any work for a community without the community at the table, because the community is the table. Early, that meant a lot of outreach, and then it also meant a lot of, wearing my other hat as a clinical associate professor at UW, demanding that we get data, because data is powerful. Data helps you advocate. And early on, we were not seeing data from the communities that were hardest hit, specifically language data. And that's something that we needed to advocate for. And then it was looking at policies with a lens of, is this policy hurting or harming communities that are not at the table, or communities that have faced things such as institutional racism or discrimination, or have been made vulnerable by our policies, and things that were happening fast, like telemedicine, the digital divide, access to information in a language that someone prefers or understands. So it's an ongoing and daily thing that we continue to do every day. I'm a huge advocate for bringing resources into communities, and for COVID, it's meant advocating for testing sites in the communities that have been most affected. It's been advocating for vaccinations to happen where people feel most comfortable, whether that is a local church or a mosque or a local community center. And it's running campaigns that truly partner with the community and addresses their concerns, and knowing that we are hoping to do this in partnership, and we want to be held accountable to the services that we say that we are going to do, while acknowledging historically things have not been good and harm has been done, and how we can focus on restoration and moving forward. So I think my lens today comes from all of those things. I don't think I can separate one from another. It comes from being a parent and seeing how this pandemic has affected children, specifically being out of school, how it's affected the mental health of specifically teenagers and families, the inequities that have come up in basic life needs such as food, transportation, and housing, and just the toll that it has taken on communities who have faced illness and death and access. So that's kind of the ones that I will be speaking from today, and it's truly an honor to be here with you guys.
Thank you. Anne.
Thank you so much. It was beautiful to hear from the two of you. I'm Anne Ishimaru. I'm associate professor, as you heard, in the College of Education. And like the other two, I'm also a mom. I have 3 of my own kids. I'm an auntie. I'm also the daughter and granddaughter of Japanese Americans who were incarcerated during World War II. And that really also shapes the kind of approach that I take to the work that I do, both in terms of trying to understand how school systems have historically and continue to reinforce racial inequities and injustices, but also can be an avenue and force for change, and to think about what is the role of formal leaders, but also families and communities in making those kinds of change, and in leading towards more just schools. I'm also grateful to be living on the unceded lands of the Duwamish and the Suquamish and the other Lushootseed speaking Coast Salish people. During the COVID, during the time of COVID and the continuing time, I really appreciate what you said, Dr. Ibrahim, about taking a lot of time to listen, because that's what I spent a whole lot of time doing, and really trying to understand and listen and reckon with the experiences that particularly families of color were having in relation to the schools, but then also the ways that that was intersecting with all these other systems and challenges around food insecurity and housing and economic insecurity. And then also the kind of racial reckoning that has continued on, that many families are grappling with, many young people are grappling with. And so I think one of the things that really came out was that many of the issues that were exacerbated during the pandemic existed prior to the pandemic. Many of those issues in schools. So families of color have had alienating and marginalizing experiences of schools for long before the pandemic. And anti-Blackness is a particular form of violence that is experienced by Black children and families in both in and beyond schools. Indigenous families and children are experiencing erasure and the impacts of colonialism. And in some ways, those dynamics haven't changed. And in other ways, they've actually been heightened. We also have renewed forms of anti-immigrant sentiment, anti-Asian racism and xenophobia as well. And so, I'll talk a little bit more about this, but, those early days of the pandemic were challenging and chaotic, but they're also very eye-opening for many families. And on the one hand, families actually were seeing what was going on in classrooms in a way they never had before. And many children, especially Black children, were actually more at ease at home. They were no longer under the constant gaze, the white gaze. They were being judged for their behavior or their clothing. And families could see actually how their children were being treated. And so as the dynamics have changed and schooling, have been returned to classrooms, there's been a great deal of racial disparity in the way that that's been happening. A far greater percentage of kids were back in person. We have national data from IES, from the Institute for Educational Sciences, that while about half of children in this was January, about half of white students were back in full-time learning. 43% of Native students, 28% of Black students, 33% of Latino students, and only 15% of Asian students were back in classrooms. And we've also had this huge increase in homeschooling. And one of the things that we're hearing about is just in the wake of the murder of George Floyd, Black families in particular have recognized the anti-Blackness that permeates schools, and we're really thinking about how the notion of safety goes beyond physical health. And I just was really struck by one of the mothers that we heard from said, I didn't trust schools before. How can I trust them now? So I think the pandemic has really highlighted the ways that safety is connected to all these other dimensions of children and families and their well-being, their psychological, social, emotional well-being. The academic learning is intimately tied to all of those kinds of things as well. I've been deeply humbled to hear about the complex challenges that families experience, but also the resiliencies and the ways in which they have continued to support the learning and growth and well-being of their children.
Thanks, Anne. Yeah, so thank you. Some of the things I'll say will maybe touch on the things you've already brought up, all three of you, a little bit. In general, my research focuses on the effects of stress and adversity on children and families. And our work aims to understand factors that contribute to children's resilient or vulnerable responses, protective factors in families and communities as well. And so given that's my research, in fact, when COVID hit, we were in the middle of a couple of studies collecting data already on families and their stressful experiences. So it gave us a chance to pivot a little bit and ask families how they were doing during COVID. And so some of what I'm going to say is going to reflect what you guys have already been bringing up a little bit, that we know that families who were in lower income range experienced much more COVID-specific stress, many more uncertainties, changes in their job and income situations, and food and housing insecurity, and also those families also were more likely to be in contexts where they're exposed to COVID, where there were health risks, where they had family members who contracted COVID or died from COVID, or just were in work contexts that exposed them to COVID. So those two stressors, really strong predictors of how children and families were doing in the context of the pandemic. Heather, you brought up income insecurity, or just fluctuations in income. We, in another study that we were doing, that those fluctuations in income had an impact at all levels of income. So families who had their jobs become uncertain, or their businesses, that created a lot of stress in families. When there was that stress, we saw more conflict. We saw more mental health issues in parents, and children's mental health tracked really closely to parents' mental health. That parents' emotional and mental health responses to COVID had a significant impact on how kids were responding. And I read an article today and how children's mental health responses were strongly impacting parents too. So this kind of mutual effect of families who were suffering, just kind of snowballing the effects of income or the strains associated with that, with the coronavirus. But we also know that there were some strengths in families that really supported kids. So when families were able to maintain or create quality time out of this context, when they were able to sustain some kind of routine for their children, and when children felt supported by their families, their parents, their friends, or had social connections, they tended to do really well. And these things have held true for our study with very young kids and for adolescents. So we can see that these connections between the different disciplines that we study have had meaningful impact on kids. And as you've said, kids have gone back to school, and the context has been a new layer to this challenge for many kids. So tell us, from your perspective, how you see children and families are doing right now. How are things looking for families in this new kind of context that we're in now?
Yeah. So there are still some children who are not physically back in school, but most of them are. And that's been a really marked change. I think that many of the children, the families that we've heard from, they're very happy to resume social interactions, to be with their classrooms, to be with their teachers. But at the same time, though, I think one of the things that's incredibly challenging is that the schools have largely returned as though little has happened. So there's this rush to focus on getting back to quote unquote normal, to addressing, there's this really dominant narrative around learning loss. There's a lot of jumping back in, and there's maybe a lesson or two from the social emotional curriculum, and a lot of lip service about the need to attend to social and emotional well-being. But then there's always, then there's actually this jump back into business as usual. So we've got a whole lot of testing going on to try to assess where children are at in their academic progress, and so that as a result, both kids and adults are struggling because we haven't really reckoned with what's still happening. So many, we're talking about hundreds of thousands of people have passed away. We have a large number of children who've actually lost a parent. And then we have all these other cascading impacts that are happening as kids are back in schools, the new protocols that teachers are having to try to manage. We've got bus shortages, we've got sub shortages. We've got teachers who are leaving the profession at the time that we really need them. We're in a situation where many district leaders are going back into classrooms to try to cover the subs. In Seattle here, they just put out a call to parents and communities to try to get back into the classrooms. So I think one of the things that's really disheartening to me is that we had this opportunity because the pandemic threw everything up in the air. And all these things that we said weren't possible, all of a sudden had to shift out of necessity. And schools in particular, I'm I'm not going to say the other institutions did this or didn't, but because of my focus on schools, they didn't use that opportunity to move differently. And that has been to the detriment of children and families. And, I think that if we can, there's still an opportunity though to think through how we might move away from the testing, the accelerated learning idea, the accountability, and especially this kind of individualistic remediation paradigm that we've sort of doubled down on instead of shifting gears and trying to do something different. And I think that some of the racial reckoning that I was referring to earlier, it's still there. That hasn't gone away. And there's an opportunity for our schools to really learn lessons from the pandemic about humanizing children, about humanizing their families, about adults working together in new and different kinds of ways, and really trying to hold and reckon with the loss and grief that many children have experienced, but also building from the kinds of things that you were talking about, Liliana, the kinds of the strategies and the resiliencies and the learning and the cultural practices, and even the forms of resistance and change that we saw young people in the streets. They were often in intergenerational ways learning about histories of resistance, that we also have an opportunity that we could actually build from and learn from and to make change in schools.
Yeah, Anne, thanks. It makes me think how about a year ago at this time, we were talking about how when kids do go back, we're really going to have to emphasize their social emotional well-being and the changes in the loss that they've been through. And it feels like the year that went by, we forgot that, or like you said, worked so hard to dive in that forgot that this was going to be a very challenging transition for kids. So thanks. Anisa, what are you seeing? How are kids doing now from your perspective?
We're seeing very similar things. I think, when I think about kids, we kind of have these two cohorts. It's, the young kids up to early school age, and then we have teens. And I think this is some of the worst this has been a really bad time for adolescent mental health. So much happens in the adolescent years, so much change, and they have just had to do it in an incredibly difficult time. And our mental health system, our care for mental health it's abysmal for as rich of a country as we are. We are not doing well. Our mental health services, they're not integrated. They are stigmatized. There are low resources, low support, and we're not doing a good job caring for our teens because the system has not been set up that way, and a lot needs to change. And I think, in the office, we are doing as much as we can, but that's something that is at the forefront, and knowing that, these are things that cannot wait, but the resources are not in place to make, to take them to that level of it needs to happen now. I think, health-wise, most kids are doing okay, right? They have missed a lot. We have not seen many kids for their routine checkups, their routine vaccinations. There's a lot of catch-up that needs to be done. But I don't think we should mistake that physical health of children to mean that kids are they're doing fine. I completely agree with Anne in that we have went from kids having 2 school years remotely, and we know that children learn best when they are in person, to being thrown back into in-person schooling, as if nothing happened, as if we're not still in the middle of a pandemic, as if they have not just been through a significant amount, especially for their young lives, significant changes, things that were very difficult for their parents, for other adults, the loss of the isolation, the social isolation. Kids grow socially. The social isolation has been very intense, and all of these things, and they've kind of been put back into school and their other activities, and like, all right, now we're going to be back in. And then I also think, as both Anne and Heather said, like children feel what their parents feel. They pick up on a lot. And when we talk to them, when we engage in them, we start to figure out how much they know, how much they are processing, and they will do that whether we talk to them or engage them or not. So they feel a lot of what we're feeling and what we're trying to shield them from. And I think that it's been hard for families. I think childcare, as a working mother myself, it's incredibly hard, right? Kids, if your kid sniffles, you're going to get called and you have to go and pick them up and you have to go COVID test them and they miss a couple of days of school. So it is, and I sit in a place of privilege, and I need to call that out, and that, I can leave work. I have a job that will understand that. I can go get my kid. I have the resources to pick up my cell phone and make an appointment and get a COVID test and bring my kid back in and, help her with her homework. But many families, that's a lot when you have a job that might not be secure, when you cannot afford to miss a day of work, when you don't have a cell phone and you don't know, a cell phone that can tell you where the nearest COVID testing site is when you're not as connected. So the interface of childcare and school, and how much we are pushing these things where families are using paid time off. If your child is sick, you don't get vacation. Right? You don't get to rest and refill your cup. And I think most people's cups are half full right now. It's so hard. And that's what we're forcing parents and educators and everyone to deal with without really stopping and kind of hitting the reset button. And I think other things that we've lost in the past kind of year and a half, I think, our specific clinic was very resistant to telemedicine, go, because due to the digital divide, due to how people feel comfortable, due to privacy, there's many things that make telemedicine not ideal. And, hospitals right now are full COVID, specifically right a couple of weeks prior, the Delta variant was not looking good. It was highly infectious. But we have to show up for families in the way that they can access care. And it's stressful when your child gets sick and you don't know what it is. And you don't know how sick they're going to get. It's even more stressful if you're worried about your child for another reason. They might have another comorbidity, or they might be sick for another reason, or you might have other people who are sick around them, and you have a short window to get to a physician and see them and get reassurance and do so many things. So I think the kids are resilient, but kids shouldn't need to have that. I struggle a little bit with that word, because resilience is beautiful, but that's not, they don't need to be suffering. To be resilient means you've struggled, and that's just not what I want for children. I don't think our society should want that for children. We shouldn't need to have resilient kids. And right now we're not doing great at creating a childhood for kids, or creating systems and policies for kids so that they don't need to do that.
Yeah, well said. Thank you. One question I did have is in this fall, as kids have been going back to school, we also had the Delta variant surge. And we were hearing that kids were more affected by that. And I wonder if you heard that anxiety in parents in your clinic or in your work. Were parents worried, or was it not? Were they feeling okay about them going back to school?
Yes, I think it was a little bit of both. I think that I certainly, as a parent, was a little bit worried, right? Because I'm sending my children who are not vaccinated to school with a Delta variant that we know is highly infectious, much more infectious than the original Alpha variant. And, we are just trusting the systems, right? And knowing that is really the mask and social distancing and hand washing were their mitigation efforts. So many families were concerned, they were worried. But then the schools made it difficult. The system made it difficult. Many people's choices as working parents were send your child to in-person school or pull them out of public school to put them into remote learning online, which was homeschooling. And that's not a choice, that's not a choice. It was send your kid or homeschool them yourself, essentially. And that felt like a very, very difficult choice. And some people who had enough means that, like we were seeing, the people who have means always figure out ways to make it happen. pulled their kids out and they had learning groups and things like that. But the vast majority, I don't think those anxieties were addressed. And I think the biggest misconception is that, kids are somehow immune to COVID, and they're not. They're not at all. The kids do get sick. They don't get sick at the rate that adults do, but they get sick, and children have died from COVID-19. No child should die from a preventable illness. It doesn't matter if they have a comorbidity. There is no but this child. That's one of the things that bothers me so much. No child should die from this preventable illness, and we can't even excuse one pediatric death. So it was a really scary time, and I think that there were no, I think the individual schools did what they could, but there weren't many options available. So many parents were very, very scared, and it was also, destructive seeing the numbers come out. 3 days in, there were over 100 COVID cases in Seattle public schools where my kids were. And that's a scary email to get to say that that's already what's happening. And it's been fine. The numbers have been good. And now we're looking, down the line, hopefully the vaccines will be available for kids. But it's very, very worrisome. And as a parent, counseling other parents, you can only tell them what you would do for your own and what the evidence shows. But there was no guarantee that your child was not going to catch COVID, and that they were not going to bring it back into the homes. And so for many families, it was a hard decision, saying that we've been so careful for 18, 19 months. And now I feel like I'm throwing my kids into the lion's den, right? So careful. And now we're just like, all right, school of 500. We needed to sit with that at the beginning of the school and really balance that with the risk versus benefit of, in-person learning is really important for kids. That socialization is really important. And thankfully with these mitigation efforts, and now hopefully pretty soon pediatric vaccinations, it's starting to look like it's going to be okay.
Yeah. Thank you. Anisa and Anne have both talked about these experiences and disparities in these experiences. Heather, how do you see families and children are doing now? And, especially as we've seen some policies put in place that are intended to support families. So just wondering what you are seeing.
Yeah, you anticipated my good news, bad news story.
But you'll expand on it.
Yes, but I guess it's nice that there is some good news. So I think the economic report on families and children right now is very mixed, both because there's been some really terrible economic tolls on families with children, and also, as Lily suggested, and I'll talk about a little bit, some changes in our safety net that are really quite incredible to see. There's also, though, as the other panelists have alluded to all along, a lot of differences in how families are doing economically by both income and race, ethnicity, and other characteristics. So the bad news is, of course, that has been a terrible economic toll of COVID. That toll has been larger for families with children than for others. It's been largest for those with limited economic resources going into the pandemic, and particularly for those who are already facing structural inequality. So as Anne nicely said from the very start, the pandemic exacerbated inequalities and our unequal society along race and class lines in multiple ways, including the economic impacts. I'm going to throw some statistics at you, and then I promise to go back to talking about that more interesting stuff. So real median income has gone down for the country as a whole for families with children. That's happened across all income levels, but the largest percentage decreases have been for the lowest income families. So another way of saying that is we've seen both the level of income in the country decline, but also the inequality become greater during pandemic. You probably know, many of you know, that we measure poverty officially by comparing a family's pre-tax income to some poverty threshold or poverty line, which right now for a family of 4 is about $26,000. The poverty rates in the first year of the pandemic for children went up from 14% to 16%. Again, it's important to note that 14% of children being poor was never something we should have felt proud of, but it has gotten worse. And very importantly, these rates vary dramatically by race. So for Hispanic and American Indian, Alaska Native children, the rates are over 20% of children living in families with insufficient income. And for Black children, it's over 25%, 1 in 4 African-American children living in a family with insufficient income. And as the other panelists have mentioned in a variety of different contexts, poverty has real consequences for parents' ability to provide housing, other basic needs, food, education, et cetera. So we saw food insecurity rates among children double early in the pandemic. This is something that was actually, we were able to track with data quite well because of a special survey that went into the field and measured this every week during the pandemic, continues to measure it. This means that parents were reporting to the surveyors that they had insufficient food in their homes, they were skipping meals, they were going to bed hungry, right? We often see an increase in child abuse and neglect during economic crises, in part because there's a very close connection between economic hardship and how we define neglect in our child welfare system. Interestingly, the data from COVID suggests a sharp decrease in child abuse and neglect during the pandemic. But what this is believed to reflect is that most mandated reporters, people who would usually make reports of child abuse and neglect, including doctors, teachers, police, were seeing children and families much less often than they would have been during normal schooling, normal doctor's visits, things like that. So that's an interesting fact that we sort of don't know what the reality was on the ground. As Lily mentioned, there's some good news here from my perspective, at least, which is that the government responded more aggressively to provide support to families with children than we ever have before in our history. There were several big ideas that were evidence-based that had been long discussed by advocates for children and families, and also by researchers that were often seen as politically unrealistic, and they've come to pass during COVID. It's meant a huge expansion in the safety net for children and families. Let me just give 2 examples of how that played out. One is the child tax credit, which hopefully most of you are aware of and receiving if you have children. In the first legislation signed by Biden when the Biden administration began, they took an existing tax credit that was previously mostly benefiting middle and upper income families, and they changed it and made it into a generous and near universal monthly payment to families with children. We are already seeing clear evidence of the benefits of this program. I should note it's temporary, and I'll talk about this a little bit later in our panel, but it would need to be made permanent for it to stick around. One of the things we've seen clear evidence of is a reduction in food insufficiency or food insecurity among families with children when the checks started going out. So really clear evidence of that connection. In Washington, there's evidence to suggest that families are using that tax credit to buy food, to pay bills and rent, to pay down debt, things that we know are really going to matter to children's well-being. The second example I want to give is free and reduced price lunches in schools, which has had a really interesting expansion during COVID. Of course, this is a long-standing and very successful program, federally funded, but implemented through schools and child care centers. It has been shown throughout its history to reduce food insecurity for children. As a result of COVID, the first thing that happened is so many schools were shut down that there weren't free and reduced price lunches for kids. And that's probably part of why food insecurity was going up. But then schools started to get creative, providing lunches, even if they were closed, and often offering those lunches to all children and even their families, not just kids who had qualified by income. And so then when schools reopened, many of them decided to continue that policy and leave free and reduced price lunches as a program that could serve all kids in the school. This has a lot of potential to reduce stigma for the children who are receiving lunches. And it also has a lot of potential to reduce food insufficiency. So I just want to mention one final statistic. The government calculates something that's called the supplemental poverty measure, in which they actually try to bring in all these programs, income that families receive from things like tax credits and stimulus payments, and then calculate the poverty rate. So it's a little different than our official poverty rate. When they do this, the poverty rate among children decreased during COVID. It went from 12.7% to 9.6%. And that decrease occurred for every racial ethnic group that the Census Bureau tracks. This doesn't tell us that families aren't struggling. They absolutely are, and we have more work to do. But it does tell us that things would have been far worse without these interventions.
Thanks, Heather. Such an important perspective on supporting families. As you know, as we've all said at this point, the pandemic really just highlighted, shown a spotlight on things that were already happening. It did exacerbate it for sure, but it also highlighted opportunities to see what happens when these kinds of programs go into place. So now the question is can we keep them in place, or can we see this benefit as something worth keeping? Yeah, I just wanted to say a little bit more, and you mentioned this, I think, in early on, but what we're seeing right now for kids is an interesting mix of reactions to school being reopened. And when schools shut down, you know, there were the kids who were experiencing a lot of mental health issues or distress around social isolation, around losing their activities, a sense of grief and loss around valued interactions. But that wasn't true for everybody. We did see an increase in mental health concerns among children, and especially among adolescents. But there were some children who actually found that experience quite a relief, that it was nice to be home. And we've talked about this a little bit around experiences of racism in the classrooms. But other children who were experiencing other social struggles or bullying actually found great relief in being home and found an opportunity to be themselves and just kind of relax into being themselves. There were also children who really enjoyed the self-driven nature of online school. They were able to be structured and get their work done early. And while there were other children who were struggling in that very context of being self-driven and self-directed. So there was just a real mix of reactions. And so as kids are coming back to school, we just see this incredible mix again. There are some youth and children who are just thrilled to be back in the school setting. The structure and the routine is really helpful for them and supporting their mental health, and they're back in many of their activities. So some kids are thriving, whereas others are really suffering. They're either because their anxiety about going back is being really heightened, or they're just feeling a loss of this newly experienced way of living and doing school. I was talking to a youth who was saying it was really hard to be back in school 5 days a week from, whatever in the morning till dismissal at 2:30 or whatever. And I was saying, but you did that for, 8 years before the pandemic. But even just this year and a half or 2 years of disruption to school really changed children's experiences of school and has had an impact. So just a perspective on how to expect children to be dealing with this right now. And you also mentioned this in a context of a real shortage of mental health supports, and Anisa, you also said this, as many workforces are experiencing shortages, the mental health workforce is experiencing a significant shortage as well. Many unfilled positions in community mental health centers. The promise of really paying attention to children's social emotional well-being in school settings or in out-of-school settings has not completely manifested. And so we are seeing, again, this significant increase in children's mental health concerns and not the systems and resources in place to support them. So just a little highlighting of that perspective. And so we've already begun to touch base on this a little bit, but let's talk a little bit about what's needed, what are families needing now, and what can we hope for, the things that can really support these children's well-being going into the future. And Anisa, let's start with you.
Yeah, so I think that's I mean, it's such a big question, right? Like what do families and children need right now? I mean, I think if I had a magic wand, I'd say like an overhaul of like 6 different systems to really fully support families. But right now, I think it is a how to best keep the entire family's well-being and not just health. As a physician, I think when I speak, most people think I'm referring to health, but it's truly the well-being of the family unit. How do you keep that going, right? We cannot have kids performing, expect kids to be doing well and performing well in school if their basic needs are not met. And right now, the basic needs are housing and food and transportation and feeling safe. And those things are first and foremost. And I think a lot about that because my job as a physician is so little. What I do in those 4 walls, right? Vaccinations are super important. I think the metrics that we do in the clinic are super important, but it's such a small part of the actual health and well-being of families and of communities. And it's first and foremost, are these basic needs being met? So the things that Heather was saying are, do people have enough money to meet their basic needs, to be able to provide for children, and what things do we need to do in order to make sure those basic needs are met specifically for kids? Are we protecting them and uplifting them in the way that we need to in schools? And that includes a lot of their identities. And many times I think, we do this thing where we can have these really important conversations among adults. The racial reckoning, racism, anti-Black sentiment, anti-Asian hate, like all of these things at an adult level, and forget to include the kids who overhear these conversations, and then they're left to their own narratives without the support from adults to have these conversations at a developmentally appropriate level, because they have experienced it. My children have experienced Islamophobia in the middle of Seattle. And if I have not talked to them about that, that's something that I would have never known, right? So it's these things where we really do need to have these developmentally appropriate conversations and ensure that our kids know that they have advocates that we're holding wherever it is, the schools, the community centers, wherever it is that is supporting our kids, knowing that they have advocates and holding these places accountable for those things. And then also looking at, I kind of think about the reactionary method of things that we've always been taught. So if something happens at school the next day, right? Something big happens at a school the next day, we have more counselors and we have more check-ins and we have more, et cetera. This is what our kids need at baseline right now. The trauma of the past 2 years has been so significant that we need to be getting ahead of it. I think a lot of these social supports need to be consistently happening for kids, and it should not be in response to an ultra traumatic event. It should be to help them at that basic level of, you have just, you've experienced a pandemic. Now you've been put back into school. Now there's all of these things that are, that might be really scary, that we need to stop and take a chance to talk to the children about. And to be, real and honest with them. I think when kids don't have words for the things that they are experiencing, they will show us in different ways. And kids will become, if they're afraid of, if they have a family member who's an essential worker, and they're afraid of that person catching COVID and passing away because they've had a similar thing happen, they will be sick multiple days in a row so mom can stay home, right? Because that's their way of protecting their mother. Kids will do many things to, because they're worried about things. And until we start kind of stepping back and saying, what are the things that the kids need? What are the conversations that we need to have with them? Again, at a developmentally appropriate level, in a culturally important and congruent context. Every family is different. Every, culture is different and beautiful in the way that they interact with their children. But how do we have these conversations to know that, it's whatever you're feeling is okay. I think in America, we have a strong culture of being okay all the time, and teaching kids it's okay not to be okay. And in that, there's power, because then you get to state what your needs are, and we can work together to figure out how to do that. But in a system where, the normal response to how are you is good, right? Like, before you think about it, how are you doing? Good. That's what we're all saying. Our kids learn to do that. And I think this pandemic has kind of ripped the Band-Aid off of that. And we need to, use this moment to figure out what are the other supports that we need to do, and how do we, as we're working to get there, right? Like, we don't have the resources for tomorrow to have as many mental health counselors as we'd like, but what do we need to do to continue that support until we get there, to make sure that we are consistently looking at that end goal, and not letting the systems, not accepting the status quo, really not accepting the status quo.
Thanks. Anne.
Yeah, I just really resonate with so much of what you said, Anisa. I think about it at different kinds of levels. I think one of the things that, as all of us have been saying, the pandemic really highlighted the ways that all of these systems are connected to each other. And, I think, I really appreciate the opportunity to come together and talk across these kinds of disciplinary and field and institutional context, because there are so many ways that these things are converging. And so I think that that's one of the things that we need to do more of, and to think about and to recognize how these different systems are intersecting, how we might strengthen the connections between them, how we might build out the social nets, because as Anisa said, we're not going to have the influx of resources we need to have as many of the social workers and counselors and all those kinds of people that we need. So how do we leverage the synergies across these different institutions and across our different fields, to build that net better, and to foster those kinds of synergies to support children and families. And I think I think we have a lot to learn from the folks, especially who are working in the disability justice movements, around the kinds of community and collective care and mutual aid that unfold in those contexts, often out of necessity. And so I think that that's another place that we could be learning more, and doing things differently. And then I think at the level of young people and families themselves, they are the experts on themselves. And I think that sounds so easy, but it's amazing how often our systems completely disregard that expertise in figuring out what we need to do. So like you said, Lily, there's a lot of variability in there. And even some of the broad data that we can see about racial disparities and inequities by economics, all those kinds of things, you boil it down to the individual child and their family, and there's different dynamics that are unfolding in those. So I think that they need us to slow down and to listen, and to ensure that they are part of the solution, so that we have very institutional centric systems. And if we can instead begin to think about what does it mean to be youth and family and community centered, instead to focus on beginning with their priorities, their experiences, and not only what they need, but what nurtures and sustains and gives them life. How do we foster the conditions and possibilities for healing, and for joy? And I think one of a colleague of mine in the College of Education, she's a really powerful Indigenous scholar, Emma Elliott Groves, studies particularly the incidences of suicide in Indigenous communities. And one of the things that she said recently that really struck me was this idea that trauma heals in the presence of caring others. And so really thinking about how do we really emphasize the relational bonds and networks and supports that enable young people and families to heal, and to also, yes, get their basic needs met, but also then to be nurtured and sustained, and towards their well-being, towards intersectional justice.
Thanks, Anne. Heather, what are you seeing as families needing and now and going forward?
So much of what's been said really resonates with me and connects to things I was thinking about. I think I want to highlight two of them. One is this idea of certain things having been revealed by the pandemic, Band-Aids being ripped off, other sort of analogies we use to describe, at least for some of us, being able to see things more clearly about our country and the structure of our country and our systems than we did before. And I feel like one thing that children and families need from us as leaders, as community members, as practitioners, is to hold on to that visibility of these issues, to not lose it, to not just go back. And getting back to something Anne said at the very beginning about schools, like institutions needing to learn from this very difficult thing that they went through and not just try to get back to normal, but really shape a new normal. I feel like that's so important on several levels. One of them for me is about economic and racial inequality, which of course has been visible to many people in this country for a very long time, but this pandemic has made it visible to more of us in ways that perhaps we were not seeing or choosing to see before. I really hope we will leverage that visibility and the political will that comes with it to try to tackle some of these more structural causes of inequality that were there before the pandemic. So I'm talking about, taking seriously tax reform, progressive taxes on income and wealth, taking seriously that we need to curb the cost of childcare for parents while also making childcare jobs and careers better for workers. The other thing that we've alluded to a bit that I wanted to name is that the pandemic has really made visible for us the lack of flexibility in our work when it comes to family and health crises. And this is not something that has to be this way. This is something where the United States differs dramatically from most other industrialized countries, not having a federal paid family leave program, most states not having a program. We're lucky in Washington to have a relatively new one. Not having universal preschool. These types of choices that we've made about where to invest and how to support families in both working and being economically productive and also doing the care work that we all are involved with in various ways. I think we really need to, if we look back on this 5 years from now and we haven't done anything to improve that, it will have been such a lost opportunity because it was just so glaringly obvious during the pandemic how poorly we had structured that support. Though one other thing I'll say is that the economic crisis is not over. And one of the things that strikes me is that COVID wasn't sort of one disruption. It was a series of a whole bunch of different types of disruptions that keep changing. The uncertainty is very present in families' lives, economic uncertainty, school uncertainty, all kinds of things. And we are coming up against some of the protections we put in place, running out of time or being ended, things like extended unemployment insurance, the eviction moratoria. So as we recover, we may have some bumps in the road and see families actually end up worse off for hopefully brief periods of time, but only if we take that seriously and step up.
Yeah, thanks, Heather. The choices, the things that we've chosen not to invest in this country, really highlight, I think, what Anisa said before, which is our children shouldn't be experiencing this level of adversity. We shouldn't, resilience shouldn't be, a goal for our kids. So I think that your points really highlight that our choice in what we've chosen not to invest in really, it has been highlighted, and it's an opportunity to maybe, like you said, keep that in the forefront. And I think all of you are kind of alluding to thinking very differently about each of our systems, or saying it explicitly, really. And we can be thinking very differently about a mental health system as well, thinking much earlier and much more from a prevention and a promotive perspective. Not just supporting families around basic needs and investing in these family supportive systems, but also thinking about, Anne, I think you were saying about how trauma heals and the support of those around us, and thinking about really supporting communities to provide that support around social and emotional well-being and mental health, thinking broadly about who can be those supports. And that, it doesn't have to be a person with a master's or a Ph.D. to provide mental health services, thinking about making the most of community health workers and, community leaders who can, be offering supports in prevention perspectives. And also thinking about, we think about children's mental health, and a lot of those services are offered through schools or contracted through community health providers through schools. And that doesn't really then include parents or the families in that context. And given how clear it is that children's mental health has been closely tied to their parents' mental health, thinking broadly about what child mental health services means, and that means supporting parent mental health and family health as well. And so thinking about out of school settings and other community settings that families are already being reached, and utilizing those communities as supporting family mental health. So yeah, thank you for these perspectives. It sounds like we all would love to see more integration across these systems and services, which is actually one of the first questions we got. Shoot, I lost the first question. No, I have it here. How does the panel, from our audience, how does the panel feel about healthcare professionals working collaboratively with early learning professionals? Data can be specifically gathered from them at general level that wouldn't identify children or families. So thoughts about that, about those integration of different services.
So I had answered kind of a written form, but I would always welcome that. I think it's one of the most important things to do, especially for for early learning. I think that can mean, sometimes it can mean different age groups or different people, but especially in that youngest age group, bringing care and health specifically to where children are and where they're going to be and where they are for a majority of their time every day, given for working parents. So I think there is a lot that can really be learned from that kind of collaborative model. I think early learning specialists see a lot more than many healthcare professionals do, because we get little snippets of children's lives, and there's so much that can happen if there's this if there's true collaboration, even before there is integration, right? In an ideal world, if there was an early learning center, then there would be an integrated mental health specialist and an integrated physician, a healthcare professional as well. But even without integration, I think that collaboration is really, really important in helping support the well-being of kids, both at a high data level, like how are folks doing, but then even at that individual level, what is going on for each individual child that both the early learning specialist and the physician or another healthcare worker can support to really improve the well-being of that child.
Thanks. Anyone else? Jan, did you want to add to that?
Oh, I'd just say that, I think that there are places where that's beginning to happen a little bit more. And then also that there's a wave of the community school model that is not specific to early learning, but that is really expanding. And I think that it has gone in waves. There was an earlier wave. And I think that there's increasingly folks looking to that model for how we might think about integrating some of these different services and using schools as a way to integrate across these different institutions and approaches.
Yeah, I would just add one other potential model, which is Head Start and Early Head Start, which also philosophically has a similar integrative approach. And it's also has an approach that involves both parents and kids in the provision, in the services that are offered. Head Start and Early Head Start are implemented at the local level. And so what actually happens in individual centers can vary a lot. But I think if we're thinking about trying to do more integration, we want to look to programs like that have been operating for a long time and trying to do it and figure out sort of what barriers they face or what challenges they face.
Thanks. I do want to invite anyone else who has questions to type them into the Q&A. And we do have another question here from Kristen. Is there much we know about how this impacted birth to 5 ages in terms of mental health and well-being on a large scale? We have some data on that, but I wanted to check first with the other panelists if they have information they want to offer on that. No one's jumping in.
Yeah, I don't have specific data, but I will say that the American Academy of Pediatrics did just call out pediatric mental health as a national crisis. And most of the data is in the 5 and above age group, but over 140,000 children lost their primary caregiver due to COVID. So if we just think about just that small portion, it's significant.
It's significant. We've done 2 studies, or I've been part of 2 studies. One study that was ours based on families here in King County, and another one that was based on a national sample of families. Both of them focused on early childhood, the families with children in the 0 to 5 age range. One of the challenges with understanding mental health of young children is that we're dependent on parents telling us how their kids are doing. And that's great because we know parents really understand their kids and can tell us a lot about how their children are doing. And also in this pandemic, when parents were so adversely affected, it's not totally clear if their perspective of their children is also colored by their own mental health. So that's just something to speak to in general. But what we did see is that parents were very concerned about their children's emotional and behavioral adjustment during the crisis. When families were able to maintain routines and consistency and have some quality time, there was children seemed to fare better. And that wasn't easy to maintain in families where there were economic disruptions and job disruptions and childcare disruptions. Childcare, losing childcare alone was a significant stressor in families over and above all the other things that we've been talking about, income and the stressors they experienced. And so even if we're not 100% sure that the child's well-being doesn't also reflect the parents' well-being or their report on their child, we know that that children are strongly affected by their parents, their caregivers, emotional states and mental states. So really those 2 things are so closely tied that we, everything we've said so far about parents and adults also applies to their young kids. We have a question from Rita. There are so many private preschools that struggle getting services to support what's happening with children. That's more of a comment. Any thoughts about that? Thank you, Rita, for that comment. And then we have another question or a comment. Much has been written about the discomfort low-income families feel about interaction with schools. These families have been more comfortable with nurses and public health personnel. What do the members think about utilizing the public health nursing institutions as primary resource? and with resources and coordinators. Anisa, do you have a thought about that?
Yeah, so I was just thinking about both sides. I'm very much in support of public health, whoever the family feels the most comfortable with, whether it's public health, nurses, or, other sectors of healthcare. I do think that, public health right now is kind of everyone who intersects with the public's job, but specifically our public health nurses. The other thing that this, the flip side of that is that there are many families who feel like, and have real experience being harmed by healthcare institutions and systems. So they might not necessarily feel safe in either of those. They've been discriminated against in schools, and they have, and then healthcare institutions and public health have significantly harmed populations, and specifically populations of color, and most significantly the Black community. So there might be families that might not feel comfortable in either of those things, but I do think that it is important to have many doors open for families so that they are able to access whichever door they feel most comfortable in, so that no one resource is not available to them because they might not necessarily feel comfortable accessing it at school versus accessing it in the healthcare setting.
And I just want to go back to something that you were saying earlier, Lily, about also what community leaders, community workers, either from a school context or a healthcare context, can be really important in helping to, they can be important folks to access, but also can play an important role in helping to kind of negotiate with the institutions. And hopefully, in an ideal sense, also getting those institutions to better understand what's going on with families. I think one of the things that we see a lot is, especially in schools, folks taking a very ahistoric notion of like, why don't they trust me? What's wrong with them kind of approach. And sometimes there are folks from communities and community leaders or community-based organizations who can help folks in the institutions begin to understand a little bit more about what those experiences are, how systemic they are, and how often historical they are, sometimes intergenerational kinds of experiences that people have had. And I think many of the folks who are interacting with families in schools don't necessarily understand the systemic or intergenerational dynamics of how people have experienced those institutions.
Yeah, I think of how important that no wrong door idea is, that where a family is already connecting is the place for them to get that support and resources. And it's not enough to just say that, right? Then those community leaders or community health workers, organizations that are doing that need their own support. And we have to think about how we as a university community or other opportunities that are available to them to get support and training around being able to do that kind of work, that support for families successfully and skillfully. So again, just thinking more broadly about what it means to train a mental health workforce and what that could look like, by really making the most of where families are already getting their support. And I like your point about how those community or individuals or leaders can also help bridge the gaps that are existing in services being or institutions being less responsive to families, and in families being able to connect with them.
And I think, sorry to jump in, but I think that, when Anna was speaking specifically about community leaders, I think that should be a sign that we need to figure out how to elevate and respect the expertise of community leaders so that they are not consistently giving us unpaid labor. And then we get to pat ourselves on the back and say, oh, look how great we're doing, when it's actually community leaders who are doing the hard work, years of trust in the community. And most of the time it's unpaid. And then institutions benefit from that work without ever looking at how do we integrate this vital resource into our system, and pay them to do this work that they continually ask for. And most often they do it because it needs to be done, with that. And then the systems then don't recognize that this improvement is happening due to unpaid labor from people who are from communities that have been marginalized. And it is a really oppressive system that kind of replays itself. And until we start pulling out and saying what made that difference, and if it's a community leader, why are they not a part of the system? Why are we banking on unpaid labor from someone's big heart to continually help us?
Totally agree. We don't have any more questions in the Q&A. I wonder if the panel, anyone has any lingering thoughts or things that they'd like to leave us with? If not, I want to thank all of our panel members. Thank you so much for bringing your wisdom and insight and work and perspective and your big hearts to this conversation. And thank you to our participants, our audience who were here this evening, and thank you for your great questions. Really appreciate the opportunity to chat. I actually just found, one more person has a thought or a question here, and I just thought I'd throw that in here. I appreciate how you mentioned disability services also being affected. Can anyone talk about any data around disability services? Does anyone have anything they can add to that?
I don't have data, but what I do have is stories, and I think stories are powerful. So many children who have disabilities, developmental delays, that needed significant services, lost a lot of that. And they've lost 18, 19, almost 24 months of these services that were really, really important to them. And now we are seeing these children on the other end because they've been burdened more than children who do not have disabilities. And many times they were thought of last because it was not just in-person school, it was in-person school plus therapies, plus accessibility, plus access to many, many different things that was ripped out, due to a pandemic. And then it was some of these services have been reinstated, but they are starting off at a much lower, essentially they are not meeting kids where they are at anymore. And it's not in any individual thing that you can point to and say, this is what happened. But when you have a child with a disability and you lose 24 months of services, restarting those services isn't going to help make up for those 24 months of services. So I don't have the data, but I think I have so many families who have been trying their utmost best, who are not able to get their children what they need, it's heartbreaking to see, and I think it's unacceptable, and those stories speak volumes.
Thank you. Yeah, in the national study that I was consulting on, families with children with disabilities were among those expressing the most stress through the pandemic. So it's been a difficult time. Well, thank you all so much for your perspective and your contribution to this discussion. I really appreciate it. And thank you again to the audience who is here and for your great questions. Have a good evening, and thank you for joining us.